Welcome, and thank you for turning to Home Helpers for help in caring for your loved one who has arthritis. Let's start off by defining arthritis. Put simply, arthritis is a disease that causes pain and stiffness in joints and surrounding tissue. Although the term literally means joint inflammation, arthritis actually refers to a group of more than 100 rheumatic diseases and conditions that can cause pain, stiffness, and swelling in the joints. The two primary categories are inflammatory, or rheumatoid arthritis, and non-inflammatory, or osteoarthritis. Non-inflammatory, or osteoarthritis, is the most common type of arthritis. This condition involves a reduction of cartilage and bone, or bone overgrowth, causing painful movement affecting the knees, hands, hips, and spine. As cartilage deteriorates, bones begin to rub against one another. As a result of this, your loved one is likely experiencing stiffness and pain that make it difficult for them to use that joint. While the specific causes are unknown, factors such as age, obesity, injury and overuse, genetics and heredity, and muscle weakness are known to contribute to arthritis. There is no cure for osteoarthritis. Treatment focuses on relieving symptoms and improving function, and can include a combination of patient education, physical therapy, weight control, and medications. Rheumatoid arthritis, sometimes referred to as RA, is a form of inflammatory arthritis, an autoimmune disease. In RA, the immune system, which is designed to protect our health by attacking foreign cells such as viruses and bacteria, instead attacks the body's own tissues, specifically the synovium, a thin membrane that lines the joints. The body's attacks on this membrane result in fluid buildups in joints, causing pain and inflammation. Rheumatoid arthritis is a chronic disease that progresses throughout life. There is no cure for rheumatoid arthritis, but new drugs are increasingly available to treat the disease. In addition to medications and surgery, good self-management, including exercise and weight control, are known to reduce pain and disability. Let's talk about some of the more common complaints associated with arthritis. Chronic pain and stiffness can be the hardest part of dealing with arthritis. It can make buttoning a shirt, walking up a flight of steps, or picking up a glass difficult or impossible. Fatigue keeps us from enjoying ourselves, and it can make pain even harder to deal with. In turn, pain itself can cause fatigue. Inflammation affects joints, making them swell and turn red and tender. Arthritis can result in depression as the patient struggles to manage the effects of the disease. The National Health Interview Survey reports that 50 million people, or 22% of adults, have been diagnosed with arthritis, making it the #1 cause of disability for people of all ages. Half of all Americans 65 and older have arthritis, with the disease showing up more frequently in women than in men. For more than 7 million Americans, arthritis is severe enough to limit daily activities. The effects of arthritis go beyond the body. The disease also crowds doctors' waiting rooms and hospitals, accounting for 39 million doctor visits and 500,000 hospitalizations each year. According to the Centers for Disease Control, arthritis costs the U.S. economy $128 billion annually. Arthritis is a disease that can affect nearly anyone. In 2012, professional golfer Phil Mickelson revealed he suffers from psoriatic arthritis, a condition in which your immune system begins to attack healthy cells and tissues, causing inflammation in the joints and tendons. He credits the success of his treatment program to his quick diagnosis. Perhaps due to its prevalence in our society, there are many common myths associated with arthritis. Let's set the record straight about these false beliefs. First, arthritis only happens to older people. This is not true. Some forms of arthritis do mainly affect elderly people, including the common form, osteoarthritis. Yet many types can affect younger people, and joint injuries at any age can lead to osteoarthritis. Currently, more than half of the population with arthritis is under 65. Juvenile arthritis can begin in children as young as infants and toddlers and affects an estimated 294,000 Americans younger than 18. Second, arthritis is an inevitable part of aging. This also is false. 30% of people older than 70 have no X-ray evidence of osteoarthritis, the common wear and tear form of the disease, according to the College of Rheumatology. For the 70% of people who do show the joint deterioration of osteoarthritis in X-rays, half of them never develop symptoms. Next, the weather affects my symptoms. This also is false. Many people with arthritis believe that cold and dampness can set off joint symptoms. In fact, according to the Arthritis Foundation, nearly half of arthritis patients think that they can predict the weather. Yet studies have been inconclusive. But don't cancel that Florida vacation just yet. Mild weather may encourage people with arthritis to be more active, and that has been shown to help alleviate the symptoms. This brings us to our next myth. Exercise makes arthritis worse. In fact, moderate exercise can help prevent and treat arthritis. Exercise promotes function and mobility, controls weight, and strengthens the muscles that support the joints. Though high-impact exercises may want to be avoided if knees bother them, low-impact exercises such as walking, tai chi, and aquatics can be beneficial to people with arthritis. Many people believe that vegetables, commonly known as nightshade vegetables, potatoes, tomatoes, eggplant, and peppers, for example, cause arthritis to flare up. However, none of these associations has been proven. If a certain food seems to have a negative effect, try to avoid it and see if it helps. Otherwise, follow the Arthritis Foundation recommendations for a diet rich in vegetables and fruits. Diet can't help or hurt my arthritis. This also is false. The Arthritis Foundation recommends a diet low in calories and saturated fats, rich in good fats found in fish and olive oils and nuts, and full of vegetables, fruits, and whole grains. Some research suggests that carotenoids, found in orange and yellow fruits and vegetables, and cruciferous vegetables, such as broccoli and cabbage, may be particularly effective at protecting joints. We've all heard this one from our moms and grandmothers. Cracking your knuckles will cause arthritis. Despite this urban legend, several studies over the years have found no association between knuckle cracking and arthritis. Persistent knuckle cracking may eventually affect your grip strength, or at the least annoy your coworkers, but it will not result in arthritis. So, how can you help make things a little easier for someone with arthritis? You've already taken the first step by understanding what arthritis means, what causes it, how it develops, and how it affects people. We've even looked at some of the myths surrounding the disease. Now let's look at what you can do to make things better for someone with arthritis. To truly understand how your loved one is feeling, you must first ask the question. Open and honest communication is essential for both the caregiver and the care recipient. Take the time to ask the question, "How are you feeling today?" Listen to the answer and act as needed. This may mean that you have to stand back and watch your loved one struggle a bit to achieve a goal that is important to them. For example, if your loved one is determined to zip his own coat, allow a few extra minutes to get the job done. Avoid jumping in to help. Learn to recognize the signs that the arthritis is particularly bad, as extra support may be needed at this time. Remember that pain can make a person irritable, angry, and depressed. This will require extra patience on your part. Be patient. The person with arthritis may have to learn to do things differently, and it may take them longer to complete simple tasks. Although not considered a direct cause of arthritis, obesity and excess weight certainly play a part. Excess body weight puts added pressure and strain on joints, making arthritis pain even worse. Help your loved one maintain a healthy weight by encouraging a healthy diet and regular exercise. Next, let's look at how you might help relieve the pain and stiffness associated with arthritis. Be aware of your loved one's medications, how each works, how each should be taken, and what the potential side effects may be. Look for these side effects. If the prescribed painkillers are not providing adequate relief, ask the doctor to review your loved one's drug regimen. Pain may be eased either by warming or by cooling the painful area. Wrap a hot water bottle or an ice pack, or even a bag of frozen peas, in a towel and hold it against the painful joint for 10 to 15 minutes. Pain makes muscles tense and more painful. Relaxation techniques such as massage, yoga, and even a few minutes of deep breathing can help. Join in. You may enjoy it too. Regular movement is needed to stop joints from becoming stiff and painful. Encourage your loved one to do what he or she can throughout the day. Pain and fatigue often go hand in hand. In fact, one can actually cause the other. That's why managing fatigue can be just as important as fighting the pain of arthritis. Exercise helps with fatigue in several ways. It increases muscle mass and strength, which make movement easier. It also increases blood circulation and flexibility, which reduces pain. In addition, exercise generates endorphins, which are brain chemicals that produce a sense of well-being and energy. Try walking, cycling, or swimming, all of which increase endurance and strength. Yoga and Tai Chi increase range of motion and reduce stress. A healthy diet is an important part of arthritis management. A diet rich in nuts, lean meats, fruits and vegetables, and whole grains will help your loved one's body make the energy it needs to function and heal. Always start the day with breakfast. Make sure to include some protein, like an egg or yogurt, along with carbohydrates such as whole grain bread or oatmeal. Support the joints with a brace or a cane when necessary. This can help take stress off joints and the muscles surrounding them, which can help fight fatigue. A good night's sleep is important to waking up with energy. Encourage your loved one or client to go to bed and get up at the same time every day. Each night, follow the same bedtime routine. This will signal the body that it's time to sleep. Whether it's taking a warm bath, reading a book, listening to music, or doing a crossword puzzle, the ritual is right if it works. Encourage a period of rest between activities. Rest allows muscles to refuel for more activity and helps to prevent injury. Stress is the body and mind's reaction to everyday tensions and changes. Too much stress can increase pain and make it harder for your loved one to deal with the challenges related to their arthritis. We've listed several things that can help people relieve stress, but keep in mind that not all techniques work for everyone. The goal is to find something your loved one enjoys, so keep looking until you find what works for them. Basic personal care is important to everyone's health and mental well-being. If bathing is difficult for someone with arthritis, encourage them to sit on a bath stool while showering or bathing. Grab bars near the tub and toilet can offer safety and security. And non-skid mats in the shower and tub will help prevent slips and falls. Encourage self-esteem and independence by taking steps to make getting dressed a little easier for the person with arthritis. Tight-fitting clothes are more difficult to put on and to take off, and buttons and zippers can be frustrating for someone suffering from the effects of arthritis. Opt instead for loose-fitting clothing. Consider replacing zippers and buttons with easy-to-manage Velcro closures. Velcro is a good alternative when it comes to footwear, too. Long-handled shoe horns can help with slip-on shoes. If your loved one or client loves spending time in the kitchen, don't let arthritis stop her. A few simple changes can make things easier. Rather than standing, Sit on a high stool while cooking or washing dishes. Look for kitchen tools that are easy to use and have large, comfortable grips. Grips also can be added to tools and utensils using foam tubing, available through medical supply stores. Whenever possible, use a machine to do the job rather than hands. Use a blender or mixer instead of a mixing spoon. Use a food processor instead of a chopping knife. If you or your loved one needs help dealing with the effects of arthritis, there are many places to turn. Here are just a few sources of information and support. Caregiving is a big, often exhausting job. Home Helpers is here to lend a hand. Whether it's to answer a caregiving question, provide an hour or two of respite, or around-the-clock care, consider letting our trained, compassionate caregivers make your life easier.